So I want to say hello to everyone. I was unable to attend the October face-to-face meeting, and I missed the last two Zoom sessions because I was in Greece, and with the time change and with my travels there, I was unable to join you. So sorry to miss those sessions. I've had a chance to look at some of the recordings and get caught up a little bit. I wanted to take about 2 minutes, have a little bit of refresher on some of the communication skills we talked about at the first face-to-face session that we have. The face-to-face meaning it was actually Zoom. When we talked about, I talked a little bit about giving feedback. That was the major focus. And we also talked about communication skills and communication styles when having a group discussion, particularly with a small group or it could be a large group. And one of the things to be thinking about, and you've had a chance to practice some of those skills in the Zoom sessions, and you'll have even a greater chance tonight with the simulation exercise and the discussion. And a couple of the things to think about is looking at being reflective on one's own communication style. Some of us tend to be a little bit more extroverted in our communication style and put everything out there and like to throw ideas out and think about them as they're coming out and really are quick to express ourselves. Others are more introverted in the style. This isn't to say an introverted personality, but in the style of more think it through, prepare the thought, and then put it out there. And most of us are somewhere in between, and we don't always follow the routine. But one of the things to think about when you're in your small group, if you tend to be one to put them out there and speak quickly, try to hold back a little bit to give some space for those that might be more on the other side of thinking it out and a little slower to respond so that they have a chance to put their idea in. And likewise, if you tend to be more holding back, preparing your thoughts before you speak out might push yourself out a little bit out of your comfort zone to put it out there sooner, because if you don't, you might miss the opportunity, and it's a missed opportunity for you, but more than that, it's a missed opportunity for the group to hear your ideas. So just kind of a skill to practice, and it does involve some reflection on one's own style and how one does it, and sort of takes away a little of the spontaneity of the conversation. It's not the same as a conversation with a friend where, it's just blah, 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 blah. It's more thinking about how you're fitting into the group conversation. So I will stop there. And again, I'm sorry I missed the last couple of sessions, but I'm really looking forward to this evening's session.
Thank you, Dr. Turner. And now,
thank you.
Mike, can you put up the first slide, please? Thank you. So this evening, we have 5 objectives that we want to go through with each of you. But first, I want to introduce myself, and then Dr. Greenwald will be introducing herself. I just retired from Wayne State on the 2nd of October, but very happy to have had 22 years with Wayne State and about 6 or 8 MyLend program, which is a wonderful opportunity. And I'm so glad that each of you have the same opportunity now through the training program that you are engaged with. You've got a wonderful group of administrators, faculty, and community friends who are very, very engaged with us. I am by background interested in gerontology and geriatrics, so the other end of the spectrum. However, interprofessional education has been my go-to for everything. So this is why I got involved with MyLend, and I'm very interested in what each of you have produced for today. You've done a great job. And I'll turn it over to Dr. Greenwald.
Thank you, Jenny. I'm very happy to meet all of you tonight. I'm in the Department of Communication Sciences and Disorders, and I'm an instructor and a teacher, but I also do research, and my clinical background is as a speech-language pathologist. So I've been involved with interprofessional practice from that perspective, and I'm really excited to go through this session with you tonight.
Thank you, Margaret. Next slide, please. As I said, we have 5 objectives for today, and basically it's an outline of what we're going to be doing. I'll go through very briefly with you in case you still haven't got the hang of what interprofessional practice is in difference from interprofessional education. Dr. Greenwald will go through the case with you, which each of you have already read through and have come up with your own team presentations, which is the most interesting part of today's session. We will then have a discussion. And last but not the least, we'll do a very quick poll to find out why does interprofessional practice matter. And by 6:30 tonight, we should be done with this. So next slide, please. As I mentioned, that interprofessional practice is really where you as a professional will be working with not just the other team members, professional team members, but also with families, caregivers, and the community, so that the person who you are caring for gets the best care. And this can be practitioners who are paid for or unpaid practitioners, like family members. Many family members don't get a payment for doing what they do, but they do it through the goodness of their heart, as well as it could be somebody like the janitor or the nurse in the school that the child is in, or it could be the bus driver. So we've asked you to play different roles in this case that we have here for you today. In addition to that, we want you to think about how intentional you are when you're working in your small group as a team, and what kind of collective identity do you come up in terms of sharing your responsibility for this patient. And it can be one of these teams that you have worked with in palliative care or primary care, or it could just be within your own home. When you're caring for somebody, you are part of a team that is caring for that person. So I'm going to take the next slide, which Dr. Greenwald will go through.
So you've all been reading about Yasmin, who's our example tonight. She's 10 years old with a history of autism, intellectual disability, seizures, and she has difficulty with communication. Her seizures are stable with medication and a special diet, but she has stomach aches and vague complaints of illness. She does attend school with an aide, and she has additional outpatient therapies. Her primary care physician, dentist, and several medical specialists follow her regularly. Her family is bilingual at home, upholds Muslim dietary restrictions. The prayers are, one of the prayer times is at 1 p.m., which is when her bus comes. And the family is very active in the autism community, talking with policymakers and other families. Next slide. Oh, go ahead.
I'm just saying next slide. You said it.
Okay. So today we're going to have a virtual team discussion mimicking what you might do in an interprofessional practice team. Tonight you'll be developing some initial treatment team goals and an overall basic treatment plan for Yasmin. One of the teams is our leadership team, and we will have discussion moving around the team so each working group can ask questions. Next slide.
So what we want you to do is to think of areas that when you look at the actual assignment to the team, what are some of the areas, specific area for each team? We have A, B, C, D, E, and F is our leadership team. So what did A have to do? What did B have to do? So in terms of the case, if you haven't seen it, you pay attention to what the team is presenting, and then the leadership team will be summarizing everything for us and giving us their opinion. But after each team when we're finished, each team, we will be breaking out into a discussion group so that you can discuss this case further. As part of what is the impact of this encounter, what kind of assessment is needed or is not needed, or what more resources could we do to help the patient, Yasmin, to better function and to be more successful in her care by the whole team. So keeping all of that in mind as you go along. Next slide. We want you to be aware that you are put into a specific role. So you need to stay in that role. So if you're a physician and you've been put in as the bus driver, don't change back to physician, stay in the role of the bus driver. Or if you are a parent in your real role, everyday role, but in this case, we made you the lawmaker. Stay as the legislator or the lawmaker in this case. Do not go back and forth. Keep to what role you have been done. As Dr. Turner said, when we started today, be respectful in your communication, allow others to give time to talk, and we said 3 minutes to discuss each question, but if you need less time, take less time. The other person can pick it up from there. And most importantly, do not use any jargon, because we want everybody to understand. And when you're in a team situation, your family and parents, you want them to understand what you're saying. So if you go into jargon and they're not going to understand it, it's going to be pointless then. So next slide.
So tonight you have an opportunity to see the information that was given to each member of the cohort tonight. The team A is our medical care team. We have a policymaker, primary care, and family member on this team. Some specific info about Yasmin's needs and situation. Her insurance caps OT, SLP, and psychotherapy visits at 8 sessions. Many medical specialties require extra authorization, may result in a high cost to the family. Many programs provide special treatment of autism, but they also have long wait lists. Yasmin's seizures require her to maintain a restrictive diet to control risk. She has chronic constipation that's difficult to control. Side effects of her medicine are also known to include GI distress, especially if taken on an empty stomach. She often wakes up with stomach aches. These go away after a nap, but mom has to leave for work and can't get Yasmin to school. This rarely happens on the weekends, but does happen on many school days. Yasmin is a picky eater and doesn't like her diet for her seizures. She's often trying to sneak food, will delay eating meals in the hopes of gaining access to preferred food later. So this group had questions of how we can best address these concerns regarding her stomach. What are the important factors to consider for Yasmin medically and some possible rule out causes? How does the current insurance climate and higher level state law influence the types of care decisions that are made for this patient? Next slide.
So Crystal, Amy, and Taylor, this is your part now. You decide who's going first and address the stomach issues, the everything that you were asked to cover in your research of this case.
I am thinking, Crystal, I can go first if you'd like. And I don't think Kaylee could join us tonight.
That's okay. You can continue.
So
go
yeah,
ahead.
I will, so my role is the primary care provider. And when I just talked to the parent, we were talking about how we might be able to best address the concerns regarding her stomach and some of the things that we wanted to make sure that we finding an effective way for Yasmin to be able to communicate when and where she's in pain or discomfort, trying to get a good idea of what her eating schedule is, and then also ensuring that she's taking her medicine with food, and that her diet includes plenty of fiber as well as fruits and vegetables, looking within that restricted diet to see which things are like more possible, and trying to find out what she likes and doesn't like, but trying to use maybe a meal diary and a stool diary to look for any particular patterns that emerge, maybe related to time of day or a particular food. And some of that may also be impacting her aversion to certain foods. We also wanted to make sure that to address those concerns that we're looking at trying to include a dietitian and possibly an ABA therapist. So exploring how her ASD may impact her food tolerance as far as textures, decisions, and that type of thing. And then just being able to work out some appropriate menus and including her even in some of that decision making and potentially food therapy. And so we looked a little bit more medically at some of those factors as far as considering and what kind of possible rule out is, again, making sure that her medication is being taken with food. Just because of the side effects and an empty stomach, but also reviewing both family history and possibly some further tests to rule out more chronic GI or related issues that tend to be comorbid with autism, but also could be from some family genetics or from the diet itself. Also ruling out some food intolerance or allergy, ensuring or identifying some barriers for that appropriate bowel regimen. Ruling out possibly pica, or related possibilities, because they also can be comorbid conditions. And then again, following up with the parent, when we were discussing, the parent has some concerns as far as anxiety, and I think part of that is the waking up with stomach aches, and it tends to be much more on school days. So looking perhaps at some follow-up with a psychologist or psychiatrist, or
that's
if
good.
they're already here.
Is there anybody else on the team that wishes to speak about the Medicare component of this case?
Sure. As the policymaker role, currently in the autism legislation, that the Michigan Autism Insurance Reform legislation, which went into effect on October 15th, that it requires that all insurance companies that are regulated by the state of Michigan are mandated to provide autism benefit to its insured members. And it should cover services related to the diagnosis. And these include like ABA, any type of pharmaceutical care, psychiatric care, psychological care, and or therapeutic care. However, it does not specify we know that in Yasmin's specific case that her insurance caps some of these therapies at 8 sessions. And so it may be that as a policymaker, we need to take into consideration that for these therapies, there needs to be an expansion to the coverage of the coverage that's provided by these insurance companies. I'm sorry.
That's okay, Crystal. It's okay. You can keep talking. We can hear you.
Thank you. But the other consideration for her is that she may qualify for secondary insurances that may help to cover some of the therapies that are required, or if she participates in some types of multidisciplinary or interdisciplinary evaluations that while she may not receive authorization in some cases with seeing certain providers, that if she's seen in a team that the providers that are authorized can still get some insight or consult from those that aren't covered in her plan.
Thank you, Crystal. So you're leading us right into our next team. So next slide is our outpatient. So team B, you'll be ready to speak. Basically in this team, we have a social worker, a speech pathologist, and an occupational therapist, and all three are outpatient providers that Yasmin's parents are going to have to interact with. In terms of Yasmin having high anxiety, she becomes avoidant and aggressive. So we have to keep that in mind in terms of the role that our social worker has to play here, because she pushes away her food. In terms of her speech, she has an impairment, and hence the weakness also with her tongue when she's trying to eat. So keep that in mind. And lastly, with the OT, just taking on the daily living task that Yasmin has to go through. She gets distracted, she's confused, she's frustrated. So these are all areas that the outpatient team will be dealing with. And as Crystal said, other therapists might be able to cover some of the costs that the medical team had to encounter, especially with the new legislations that have come in. So I'm going to turn it over to Team B, and next slide, Mike. So Team B can, so I'm not sure who's reporting here. If each one of you want to turn on your mic and speak, it's Catherine, Adam, and Angela. So go ahead.
Hello, so I'm Catherine or Kat, and I am the social worker that was assigned to in our team. And the first thing that we have is me making a referral to a dietitian to assist with our specific dietary needs. This was, a lot of it was actually talked about in the previous team, so I won't spend a lot of time here. But we also brought up the fact that she is also Muslim, and she has certain dietary restrictions also. So seeking a dietitian would also making sure there's that cultural competency of respecting their dietary needs, and hopefully finding something that would, some foods that maybe work with Yasmin to try while respecting their religious needs. The next one is, because Yasmin has high anxiety and often pushes like food away, she becomes avoidant, becomes aggressive, and her communication levels are really low. So my thought was to collaborate with the speech pathologist, the SLP, so she'd be able to express her needs through things with emotions when she is hitting those high anxiety or needing a break. And so from that idea, I would collaborate again with the SLP to see what would be the most beneficial and easiest way for her to communicate what she needs. And then Adam is our SLP.
So picking up or rolling with that, I'm the SLP. We discussed assisting with communication and having Yasmin learn the picture exchange communication system. That's just one that we had mentioned, like the PEC system. So then she'd be able to, express how she's feeling through pictures, or she can also obviously express her wants and needs. So sometimes, people believe, that she has behaviors, but maybe she's just trying to communicate. So this will allow her to, express herself. Also, there's exercises and where we can work on where she can recognize people's facial expressions. So it's matching emotions with correct facial expressions. Since she's having trouble swallowing, and there's mentioned that there's oral motor weakness, I would recommend an oral motor assessment and a swallow evaluation. That would be to see, if a procedure would be needed, or, it did mention she had a certain weakness. So it'd be get a more clear understanding of her problem with swallowing. Sometimes swallow disorders can actually lead to digestive issues. And, she has been complaining of stomach aches. And then to assist with the oral motor weakness, have her participate in oral motor exercises in a way to make sure that she's engaging, is to make the activities fun, such as there's activities like blowing bubbles, making funny faces, or all types of games. And then we also
so I'm the OT, and what I decided to do was, because she gets frustrated with daily living skills, I decided to develop a task analysis for her daily living skills. Each task will be broken down into smaller steps using visuals, so she does not get frustrated. And when she does, we can always redirect her back to the visuals just so she understands what each step is and how it is broken down. And once she's really comfortable with the visuals, they will be faded out when she's independent. And that's it.
So Angela, Adam, and Catherine, given what you have proposed, do you think you will be covered by insurance?
I mean, if we were presenting this to insurance, it would be a much more detailed plan, and depending on the insurance company.
Yeah. So just keeping that in mind, I know you had only one slide and you had to make it very precise, but you might want to get into a little bit more details, like with the PEC, what would be the cost to do something like that. Okay. Nothing wrong with what you presented, just giving you an opportunity to add more if you were going for insurance on this. So next one is Team B.
Team C, dental care. Okay, we have a dentist, we have a family member, and a psychologist on this team. You do get cooperation in the dental exam with Yasmin, which is wonderful. You do see evidence of tooth decay, gum disease, and you suspect significant pain could be part of the problem. She hates things being shoved in her mouth. She doesn't like to go to the dentist at all. In recent SLP and OT sessions, they focused on feeding, and that seems to have made this even worse. She doesn't like to go to the doctor or have shots in general. She does better if she can watch cartoons at her doctor's visits, such as on her iPad. In terms of the psychology eval, she did have one within the past 6 months. She has significant weaknesses in attention, planning, and problem solving, and her expressive language that you heard about before. Even below her mildly impaired intellectual ability, you suspect she has a high pain tolerance and other abnormal sensory perception as common in autism. You're aware of her medical anxiety and believe that positive reinforcement and exposure to practice the expectations may be helpful in preparing her for the dentist and limiting her anxiety. The problem is that she's overdue for her dental exam. Her family's taking her to the dentist, but is concerned that she won't cooperate or open her mouth. So I will let Team C take over now on the next slide, and you can explain your ideas for her.
So I was psychology for this one. We kind of talked about it in a team setting on what we could kind of do to address the issues based on what we each knew about the situation. So we looked at what are some reasons that she might not be cooperating with us. So that something pointed out was the recent appointments with the speech pathologist and the occupational therapist. If she's having aversions to it with her sensory issues, then having those exposures might increase what we would look at as behaviors, just because she's got that recent memory going on with all of that. Something else that is a reason she might not want to cooperate at the dentist is that she doesn't like doctor's offices in general, and the dentist is a doctor's office. And you're going to have to see different medical professionals there. And she has the abnormal sensory stuff going on that's indicative, typical with ASD. And it can typically be a painful office depending on what kind of procedures need to be done. Also, it kind of can look scary depending on what kind of tools and instruments need to be used. So kind of some information that we pointed out that we just talked about was the abnormal sensory perception going on with her autism. I did that evaluation, and she does have some weaknesses in attention planning and problem solving, even more so than we would expect with her mild impairment going on there. So she's not really able to communicate with us as well as we would like to, or she might not be able to tell us why she's scared or what's going on or what is scaring her in the first place about the appointment. So something I believe that positive reinforcement is going to be beneficial with her. So something that could help on that side is bringing in comfort items from home, like cartoons on her iPad. So being able to have that there, even as like a positive reinforcement for, oh, you did this, now we can have like a couple of seconds to watch this video on here. or practicing the items at home, so that way she gets exposure to the activity as she goes through before she even goes to the appointment itself.
Thank you, Ashley. Is there someone else on the team who would like to share?
Yeah, I was the family member. And so we created a list of things on how to increase our participation in the dentist's office. And within the list, we incorporated a comprehensive plan that the dentist, the psychologist, and the family can partake in. She touched on this a little bit, but preparing for the dentist appointment is really going to be from the family aspect of increasing exposure in preparation months in advance to going to the dentist to try and create desensitization of the mouth, or really mentally preparing what the child could expect. Modeling the process shows your child that it's safe and it's okay and what to expect, such as clipping a dental bib on when you brush her teeth, or using an electric toothbrush to model the noises she might hear. As a parent, I'm going to want to bring in the comfort items. A lot of times the dentist might allow them to actually watch cartoons on the iPad during their procedures if they're awake. Amelia couldn't make it today, but she may have a more viewpoint from the dentist perspective of what to provide sedation wise, possible use of non-needle injections, different therapeutic techniques to clean, address the tooth decay and gum disease while under anesthesia, if appropriate. Other good therapeutic techniques can be applied to all members of the team, including like teaching guided breathing techniques, or utilizing distraction to decrease anxiety. And the dentist's office could alter the environment to make it more welcoming and less scary for her. So that is what our team came up with.
I know you had a lot of good ideas on your team. And we'll come back to these when we go to our group discussion later. So let's move on to Team D.
With Team D, we have a nutrition team here. And basically in this team, we have a new teaching aide at the school who is being challenged by all the needs that Yasmin has had, that does have, and what her family is concerned about. Yasmin is going to be even more difficult will have an even more difficult time in school because of the new person that is in the school trying to help her. So we need this team of dietitian, the teacher, and the school nurse to work together to help the teacher's aide in terms of Yasmin having her lunch at school and not being challenged by what is being given to her. And we're looking at the team of Amelia, I think is on this next team, and Kelly and Emily to tell us what they have come up with in terms of the challenges as a group, recommending for her the school nutritional plan.
All right, so I am the teacher. A couple of things that we can do to work on the issues that Yasmin's having in the classroom. We can work with the entire team to develop some behavior management tools that don't include food. For example, we can use a prize box. Like if you put 5 stickers on your chart for doing your homework or doing well, then you get to pick a sticker as opposed to getting candy or goldfish or anything like that. So we can sort of fully avoid those foods that are not sent from home. And then I and the teacher's aide, we can sort of monitor snack trading that goes on in the classroom, because we know that's what happens. Kids are trading their cosmic brownies for their fruit by the foots all day. So we just got to make sure that that's not going on with Yasmin. And then the other things what we can do is and have that teacher work a bit on, foods that taste good but are bad for you, and sort of work on that distinction with her, as well as work on, getting through some of those texture issues and finding what foods worked well with her. And then working on that impulse control of, that's a yummy food, I'm going to eat it, even if it's very, very bad for me. So working on those things, that's what I can do as a teacher.
Thank you. Kelly or Emily?
Yeah, as the dietitian, I think first and foremost, it's important to educate the teacher and the aide on the reason for Yasmin's ketogenic diet, how it helps control her epilepsy, and just making sure that they understand kind of the importance of this diet. It would also be important for me to suggest appropriate snack and meal options to the staff and whoever's in charge of maybe supplying her meals, whether that's her family or staff at the school. And in terms of in-class snacks, I could suggest, some sugar-free candies, keto-friendly baked goods. I know some of those are available at some grocery stores. So just making sure they know what is available as well as what is off limits. So obviously no dairy.
Emily, go into a little bit more about what is off limit, so everybody is on the same page as you.
Sure. So ketogenic diet is a high fat, high protein, and low carb diet. So in high fat, high protein would be, red meats, nuts and nut butters, avocados, berries, olives, low carb vegetables. In terms of what's off limits, carbs, so any starchy foods, baked goods, candies, even some types of chips, stuff like that. So like I said, maybe she can still have some food-based treats in the classroom so that she's not completely left out, but just offering some keto-friendly options to the teacher, aide, and her family. And then also just maybe asking her parents to provide some of these treats just so that it doesn't completely fall under the teacher and aide's responsibility.
Thank you.
Yeah, and then as the school nurse, working with the team again to implement that behavior plan consistently across all disciplines in the school day, working to develop an easy, accessible nutrition tracking system for school that likely the aide or whoever's with her during the day would be inputting things onto, such as carbs, calories, and or food intake that she has, to help with those seizures and manage them and keep track of what's causing them. And then determining who can help with seizures. One of the problems was that I, as the school nurse, was only there a couple days a week. And so making sure that plan is effective in who is administering medications, if she has a seizure, who's helping to intervene in that, when tracking when seizures are happening, and then kind of being able to give that information back to the family or the doctors so everyone has access to that and making sure that they can manage those for her.
Kelly, what kind of tracking system are you going to be using that everybody can understand in the system?
Yeah, I think that's where kind of collaboration with the doctor comes in mind. Maybe it's how long her seizure was happening, or what observed behaviors were occurring during the seizure. And then I think like certain staff would probably be trained in helping her while she's going through the seizure.
Okay, let's move on to Team E. So Team E is the school communication team. We have an audiologist and a speech language pathologist, and it's talking about her hearing evaluations. She was distractible and had poor compliance when they tried to test her hearing. The second one showed mild sensory neural hearing loss at high frequencies, worse on the left. She may benefit from an FM system, but also would want follow-up evaluation because of her non-compliance. I'll let Nicole talk further about these issues. In terms of her speech and language, she does go to a private practice SLP, and then there's also the SLP at the school. She does have expressive language impairment, like we talked about. She struggles to communicate her emotions, which we have touched on in one of the other teams. Her receptive language skills are average to low she has related difficulties in reading, writing. And so I'll let you go ahead and take that, Team E.
All right, I can start us off. So I was the audiologist, and so I had a couple recommendations for her communication and figuring out if she's hearing okay at school. And so one of those would be to provide an amplification device to see if there's any improvement in hearing until a repeat screen can be administered, since there was some hearing loss detected on the one where we weren't sure if she was participating super well. And so making sure that her IEP has accommodations for optimal hearing, being seated near the teacher and asking her parapro or her teacher's aide to not be talking while the teacher talks, which had been an issue in the past. And then also conducting a repeat audiometry assessment, this time trying to use some play audiometry to get her more involved, and maybe asking an ABA therapist to assist in making that something she would cooperate in, or completing a functional behavioral assessment to help make that more possible to do than in the past.
And then going off of that, after we've kind of figured out her where she's at with her hearing, the next step we thought was to work on her communication skills, especially. So to do that, we thought that the next step would be to adopt the use of an adaptive communication device that uses a picture system. So this is a communication technique that she has not used in the past. And unfortunately, and with any efforts to communicate in the past, it's usually ended with frustration, and she has been labeled as non-compliant. Granted, the school thought it may have been because she wasn't able to hear, but also that frustration is a very natural reaction when you're not able to express your feelings, you're not able to communicate with those around you or let anyone know how you feel. And so starting, and unfortunately this caused a little bit of a vicious cycle with impeding her growth as well. So starting small with communication using pictures is a good first step, and it also has been proven helpful in children with impaired expressive language skills. And then we also thought it would be important to emphasize use of speech when she's calm, because as I mentioned, like efforts to communicate in the past have ended in frustration. So approaching her with this device when she's calm will hopefully show an improvement not only in her communication, but also in her affect and outlook. And then it's also really important to coordinate the treatment plan and share progress between the school and her outpatient rehab facility, just to make sure that they both know where she's at and everyone's on the same page, so that there's no like redundancy or jumping ahead when she's not ready.
Thank you, Sarah. All right, and then in terms of policy, we talked about making sure that any assistive devices or screens or picture communication system that she needs at school is also accessible at home for her. Advocating for acoustically friendly classrooms, so making sure like that the construction of the walls is kind of good in terms of like reverberations and you're not hearing nearby classrooms, as well as this shows a need for audiologists to be trained in screening children with behavior and attention issues to make sure that we get good screens so that we can use those screens appropriate to get the appropriate treatment when needed for children.
Great job, Nicole and Sarah. We can go to Team F.
So with Team F, this is our leadership team, and they've had the biggest challenge because they had to listen to all of our prior team members discussing and providing their recommendations. Team F, do you need a little bit more time, or are you ready to give us your synopsis of what you think would be the recommended plan of treatment for Yasmin?
As a teacher's assistant, I'm gonna say that was quite a lot of information. So I've just kind of been taking as many notes as I can. I think it sounds overall, it's so comprehensive, and I'm having a hard time wrapping my head around it. I did have a couple questions in general for primarily the nutrition team, and then also the communications team, and then a general question for the group. So just going to team D. So I understand that it's prescribed as a dietary restriction for managing seizures. One of the main questions I had for the nurse was, so we were talking about tracking duration of seizures. So she hasn't had a seizure in about 6 months. So in the meantime, is there something we can do to be tracking progress? I don't want to be part of instigating a seizure, but I'm not sure how we would track that progress if one isn't occurring. As being with her throughout the day, I'd want to be as prepared as possible for what we could be doing to manage that.
Yeah, kind of going off of what we said earlier, some of that tracking is whether or not the seizures are present during the school day. So that lack of, and then just the medication, as well as when the medication is administered as opposed to food, because that was something that was recommended with her stomach aches. So I think that would be my suggestion on that. Any other questions with that?
I'm gonna let someone else before I just take up the whole time. Allison, or I know we've got a group member.
Heather, if you want to type something in the chat, that's fine. Go ahead, you can type in the chat if you have questions, but Allison, maybe you can take on the next part of this.
Yeah, so as the developmental behavioral pediatrician, my main concerns are really surrounding the dental care and the medical care. And we also decided we are going to try to take over some of Heather's role. So I'm also going to talk a little more about the outpatient care side of things, which makes a lot of sense because all these different factors obviously are working together. And that's really my goal as the pediatrician in this team, is to try to encourage that collaboration between all these different providers. So I guess one question I had about the dental care side of things is, it sounds like there's a lot of different ideas for how we can maybe build some tolerance for these dental appointments. So I guess I wanted to foster some of that collaboration between a few of the different team members from different teams to talk about how we really could build up some of that tolerance and the different strategies we can use. So I know we had psychologists talking a little bit about this, and I think this would also be a great place for psychologists to maybe collaborate with OT and ABA. So I was kind of hoping that maybe psychology, ABA, and OT could talk a little bit more about this sensory side of things or tolerance side of things for the dental appointments and dental care in general, so we can make sure that the dental side of things is being addressed. So I was hoping that you all could chat a little bit more about those ideas and come up with maybe who is going to address which aspect of this dental care component.
Allison, give them a minute to respond to you. So the person who did the OT in this case with Yasmin, can you unmute and respond back to Allison?
You cut out a little bit, so I didn't hear the last part of the question. I apologize. My internet has been weak.
That's okay. I was basically talking about this dental care side of things and what types of essentially skills or resources or techniques these different professionals, y'all, could bring to the table to address this difficulty with maybe tolerating these dental appointments or things going near her mouth, for example. So what types of strategies or techniques could OT bring to the table to address that?
Basically, we could try different toothbrushes with her just to see which one she would gravitate to. And if she did prefer one, possibly trying different flavors of toothpaste. In the past, I've worked with kids that didn't necessarily like the flavor of a specific toothpaste. And if she did prefer one over the other, maybe that would allow her to put the toothbrush in her mouth, and using visuals like video models and modeling it for her just to see if she would basically take to putting a toothbrush in her mouth, just using resuscitation techniques with her.
Angela, would you recommend actually demonstrating with maybe a teddy bear or a doll?
Yes.
For Yasmin.
Definitely.
Allison, you want the speech therapist to respond next?
Sure, that works. Yeah, and ABA or psychology too.
So in terms,
Ashley, go ahead.
In terms of psychology, I think that it's really going to be important that she has multiple exposures to these things so that she gets the repetition of the practice, whether it's working with the toothbrush or the toothpaste or just doing the clipping of the bib and like going through the whole process of what we kind of expect. So like when we go to the bathroom, we go into up to where we take care of our teeth, we get our bib put on, we do our toothbrush, we look inside of our mouth, those kinds of things. So making sure that we get that repetition to it, because the more she's exposed to it, the more she's going to be desensitized to the whole process itself and the appointment itself. Also, making sure that as she does the task, that she gets a lot of positive reinforcement. So when she does let you look in her mouth, she gets some kind of positive reinforcement, whether it's verbal or extra time with her iPad or just some kind of interaction between you and her to let her know that she's doing a good job. So she gets that additional support in her process. So that way it kind of reaffirms we do this and we get good responses for it because we're doing what's expected of us. That way we can set her expectations up for the appointment. Because if she knows what to expect, she'll be better equipped to deal with the situation.
To piggyback off of that, Ashley, starting in the home would be the great idea. And once we get to a state where she's comfortable in the home, then talk to the dental, I would say ahead of time, and see if we could start slowly having her come and get used to like the waiting room and taking those steps to help with her anxiety. So continuing that in the environment that the procedures would happen, I think prior to the appointment itself would be beneficial.
Thank you. And we have a message from another member of the leadership team. Heather writes, could the behavior plan discussed by the dental team be used by the outpatient team so that feeding and eating practice could continue? Does the outpatient team have any comment?
Anyone from Team B?
Or then the
looking at Catherine, Adam, or Angela. Catherine, Adam, anyone?
Adam, do you have
Catherine just spoke anyway. Adam?
I would say yes, because part of we were talking about doing a swallow eval or just to see how she's eating or feeding with the oral motor, weakness. So something, if there were issues, I think the speech language pathologist and the OT could implement both those feeding and practice techniques.
Any exercises you would suggest, Adam?
I guess it kind of depends on well, some of them that I read about to keep children engaged. We're doing things to strengthen the jaw muscles, such as like blowing bubbles or using straws.
That's what I wanted you to repeat because you had mentioned it.
It was like blowing bubbles, using straws to like blow things across the table. There's card games where you have to imitate like funny faces. Because I know she had issues with chewing like meat and stuff like that, so she might not be able to get the nutritional intake that she needs.
Would you suggest pureed food? Would you suggest pureed?
I guess there was no mention of aspiration, so I guess maybe, like I said, more details would come to light after the evaluation. But like I said, there's that challenge of like, the dietary due to the seizures and culture. So maybe softer foods if she continues to have trouble or pain, but pureed if it's no aspiration, probably not at that point.
Okay. And nutrition team, anybody has a comment here?
Please.
Amelia, Kelly, or Emily, we're looking at the question in the chat, discussing the behavioral plan. Is there anything that the nutritional team can add to feeding and eating practice?
Relating to dental specifically?
Eating practices, what could you suggest here, given what you heard from Adam, Angela, and Catherine? Is anything else your team would like to add as recommendations for the leadership team?
As the teacher, I'd love to have some homework that I could do with her, seeing as in these COVID times, a lot of meals happen in the classroom with the teacher present. I'd love some homework that I could work on with her during that mealtime.
That's a good point.
Eating homework, not like math, like eating assignment. I should clarify that.
Good point.
Kind of going off of that, so since so many meals do take place in the classroom and we're kind of doing we're having a lot of issues with Yasmin wanting to eat the correct foods, and she likes to sneak foods, and obviously it's understandable. Keto can be pretty challenging, especially when we love sugar. So one of the concerns that I would have would be managing, and on my part, I'm relatively untrained in behavior management. But I've seen feeding programs can be very, very challenging for the child and for everyone involved. What sort of supports would we have in the classroom for keeping that a safe environment for Yasmin and for everyone else who is involved to handle any severe problem spikes in behavior we might see? That's a kind of an open floor question.
Good question. Maybe the school nurse can jump in here and provide some feedback to Ada.
Yeah, I think that comes across with like consistency and how the school is doing things wherever she's traveling throughout the school day. So that behavior management, the application of how she's getting food throughout the day, as well as even like we talked about those rewards, making sure that there's consistency across all areas would help with that behavior, that impulsivity, that kind of thing with the food.
Good point about the consistency between the different disciplines in terms of rewards. Someone spoke about, giving her stickers or something. So if that's the suggestion, Ada, then that should go across to all of the team members, whether they're the outpatient or the ones in school or the parents at home.
Sure.
I have another question I'd kind of like to pose more generally, maybe. So as a developmental behavioral pediatrician, obviously, I have some expertise in these different developmental disabilities and such. And we've heard about Yasmin having a diagnosis of autism, for example, and this mild intellectual disability as well. But I feel like we haven't talked very much about some of these attention or focus problems that were in some of these, some of the information that y'all had. So I was curious if anyone has some more thoughts about this, or maybe some ideas for how we can address these concerns about focus and attention, because it sounds like that's interfering with her functioning. So I was wondering if maybe a teacher's aide, primary care provider, psychologist, or anyone else who has some expertise in things like attention and focus may have some ideas for how we can address this, since it really is interfering with her day-to-day.
Alison, before they answer, I'd also like them to look at it from the cultural standpoint of view of Yasmin's religion and background. So go ahead, whoever is going to be answering that question.
I know from a primary care standpoint. I think I would like to have some more information on when those things are occurring, because particularly if it sounds like she's experiencing discomfort and pain, because those two things can be connected and diminish your attention. So being able to find out more about that connection would be important from my end.
And I think that would definitely be something that would be important looking at. Just sort of in general, sort of across the day, attention can definitely be a big concern. So, we do our best to keep her interested and engaged, but when there is that underlying pain and discomfort that's going on, no one can really pay attention. So that would also be a chief concern of mine, is getting that evaluated by the primary care and just in general gastroenterology, to looking into what we can do and what maybe could be affecting that from the diet that she's, and how we can get around it. So that wasn't super helpful, but just in general.
Thanks. And we have another question from our leadership team member, Heather. For audiology, would a sound field system be a better option, as it would be a benefit for all children in the classroom? As the family member, I'm concerned about her compliance with a personal FM system.
So Nicole, can you unmute and answer that question, please?
Yeah, so it would definitely be a consideration to use just a more general amplification than a FM system. I guess I would have to be in the classroom to see one, what the noise level already is, because any overall amplification might also amplify any background noise going on in that classroom. And depending on how good students are in terms of keeping quiet when needed, it might actually cause more difficulties than it would help with.
Sarah, do you have anything to add to what Nicole has just said?
I would, this kind of applies to a lot of the questions that have been asked, but just like making sure to have her opinion throughout all of this. And I think this would be a good place to use the assistive communication device with the pictures, asking her, like just going back to the dental thing, like, are you scared? Questions like that, and just getting her opinion on everything that's going on, I think would be really, really important as well.
Leadership team, has the rest of your peers here responded appropriately or answered all of your questions? Do you have any other questions, or do we move on?
Just one thing that was not addressed, and I wouldn't be sure who to address this to, the family members, maybe policy, just in general, the school board, of the issue of getting Yasmin to school when her bus comes at the same time of a very important religious practice for her, and how we could better arrange, I don't know, I'm just throwing things out there, like arrange for a different type of transport that could be altered, the schedule altered to fit that. I mean, I looked into maybe doing these things virtually, but it doesn't seem to be too much of an option. And especially in such a practice that requires specific location and placement, I don't think it would be feasible. So I wasn't sure if there were any ideas on how we could work around that, so that we can still accommodate to the best of our absolute ability to keeping her religious practices sacred for her and her family.
So I think the member of Team A, who was a legislator, can respond to that. And I know we have some more questions in the chat. So let's get to the legislation question first.
You said that the question was about her bus schedule and how that interrupts her, interrupts her religious practice.
We're looking to see if there's any policy changes that can be made regarding the conflict here with her prayer time of her parents and the bus schedule occurring at the same time. So Ada made a recommendation, maybe looking at a different mode of transportation rather than just being on the regular school bus. How would you go about addressing that, Crystal?
I'm sorry, this is an area, the transportation component is an area that I'm not super familiar with.
No, you're a legislator here. So think about this as a legislator. Your role is here as a legislator. So the problem is regarding the time of the bus and the time of her release?
Certainly, there could be some protections written into the autism legislation that where there are provisions to honor her religious practices, or some type of accommodation with a different. It's certainly something that can be considered and written into the autism legislation.
Crystal, I don't know if you've seen the chat. It says Madison had a suggestion that we could add a bus driver to the team and request the bus driver to do the route backwards so that she's home an hour later. That way they can still get to their prayers.
And I there may be some protections within special education law where to provide a form of transportation. I'm sorry, I'm looking. We could add a bus driver to adding a bus driver to the team. I'm sorry. I'm not really sure how I could write how this can be included in legislation. I'm breaking character here. I'm really sorry.
So you're allowing the bus driver to the bus company to make some decisions as to changing the route. So that might take some legislation to do, because you don't want the bus company to get sued. So that's why the question was posed to you as the legislator, whether that can be done or not.
I see. Certainly, we could give we could give transportation a little bit of leeway to provide some accommodation for families with religious.
Thank you. That's what I think the team was looking for. We're reaching that point where we need to get into the discussion, Dr. Greenwald. So let's say thank you. I think the leadership team did a good job there in terms of thinking on their feet and making sure we covered all aspects and questions related to Yasmin's case. So thank you, Ada and Allison and Heather for participating in this on thinking on your feet component of the team meeting.
Thank you. And the purpose of the breakout rooms was to let people have more of an opportunity to speak with a small group. Jenny, given our time frame, do you still want to have the 5 minutes of breakout before the group?
5 minutes, just 5 minutes and we come back.
Okay, so when you're in your breakout rooms, consider those 2 questions, or talk about the 2 questions there. How did your understanding of different healthcare professional roles change through the discussion, if they did, and what attitudes and feelings do you have about working with a interprofessional team that you may not have had before? And
so just your discomfort in doing the exercise that we gave you this last 10 days that you had to work on it. And then in your roles today, what kind of discomforts or comforts you had, and how do you feel about working, what attitudes you have about working in an interprofessional team that may have changed after this exercise. Don't get too detailed into it. Just want you to take a few minutes among yourselves to debrief a little, give everybody a little break here to talk in your group. So Mike is going to put you into your breakout rooms in a minute.
All right, welcome back, everybody. We had an interesting talk too while you were in your breakout rooms. One of the things we mentioned is that we'll be coming back to some of these topic areas during the year. And so you'll have an opportunity to learn more about those roles that you were in tonight. But let's go to the discussion questions that you all were talking about. People, whoever wants to share, tell us how your group discussed the question of how your understanding of different healthcare roles might have changed doing this team activity.
Something our group talked about was maybe noticing that certain professionals also had a role to play in different areas than maybe you would expect. So something that a few people brought up was the idea of like a psychologist being on the dental team, for example, and realizing that, oh yeah, like there's something that a psychologist can also contribute to this team, even if that's not something that you necessarily like think of right off the bat when you hear dental team, right? So realizing kind of how different professionals can work on these different teams and apply their skills to settings that maybe you might not expect.
Right. Any more comments on that topic?
Anybody had a more appreciation for the role played versus their own role? Ada?
Yeah, I mean, just as being an ABA, we typically give, and especially working in schools, it's like, here's this gigantic behavior support plan. And as a teacher's aide and as teachers, it's like, how am I going to implement this? How am I going to handle everything? Are you going to train me? Are you going to be there with me holding my hand? And the answer is not usually yes. So that was really something to think about for sure, just because there's kind of a legendary struggle between ABA and teachers. It's just like, what is actually feasible for you to implement when you're trying to work with potentially dozens of other children all at the same time who all have needs. So it was definitely interesting to look at it from that perspective.
That was an interesting question from Heather in the chat. And if any one of you want to read it out loud? Amy, do you want to read Heather's question for us?
Yeah, Heather asks, how does the communication amongst professionals occur when the professionals are not working in the same building or on the same site? I know not for my role here, but my general, like everyday role as an educator is it doesn't, in the sense of educators talk to educators, and then healthcare professionals, I'm not sure, but the communication that tends to go back and forth is primarily funneled through the parents. And so we tend to ask questions in a different way. So sometimes I think the information is inconsistent, not because it's intended to be inconsistent, but because the questions are asked a little bit differently.
And how does the parent, I wonder how the parent feels being the main conduit of communication. Do they ever express the feeling of being overwhelmed by that?
Parents I have talked to, for sure.
I think we hear that in medicine all the time, how the patient is so overwhelmed with everything that is being thrown at them and are looking for a support system. And usually it's the social worker that is doing that, or the case manager.
So knowing that there's advantages to working as a team, but this challenge of communication being a really big one, do you all have some ideas for how that could be improved?
Something I've heard others try to implement, at least, is trying to have meetings every so often, like say maybe every month, but that might be too common or frequent, or maybe quarterly or something, with more of these team members. So again, going beyond just meeting with the school staff, for example, and hopefully trying to bring in some of the outside providers, like maybe the outside SLP or ABA or whoever it may be, to try to, again, facilitate some of that communication. And essentially by having a meeting and having that meeting time kind of set, then hopefully that's going to kind of provide an opportunity for that communication to happen, and kind of also give a reminder to everyone that, hey, like, we do want to be communicating. We don't want to just communicate during this time, but it is important for us to check in. And this is one way that we can do so. So I've heard of other parents advocating for that, which again, it's unfortunate that parents have to advocate for everyone to communicate. But I think that could be an effective way, is just trying to set up some more regular meetings, because a yearly IEP meeting where only the school personnel essentially are present isn't really sufficient.
Madison, you typed something in the chat. Go ahead and read it.
I said providing written communication if trying to communicate through the parent, so it doesn't turn into a game of telephone where they get information wrong or they don't communicate the main thoughts appropriately, especially when medical jargon is used or the parents may not understand everything.
And that was why we started today with saying don't use any jargon. Be careful what you're using. And I think Dr. Edelman has a comment in there as well. The use of care maps to facilitate even knowing who are on the team would be helpful. So anything else, Margaret, you want to, sorry, Dr. Greenwald?
I think we're just about out of time with our discussion.
Yeah.
Everybody, it was a great discussion, and
We
overall,
have one poll in the chat, so if you could all click on that poll for the last 1 minute that we have here, please click on the poll and put in your answers. Well, I tend to agree with the rest of you here that it's always the different points of view that provide the best care for our patients, and also that relates to quality of care. But we were really hoping the redundancy would be reduced in this case. So, and I think we achieved that to a certain extent today. I want to thank you all for participating. I know we're 1 minute over, but you've done a beautiful job, team members. We really enjoyed your participation. I hope you did as much as Margaret and I did. So Margaret, it's all yours. You get the last one.
well, I'll just again thank them. I thought you did a great job, and I'm looking forward to the coming year where you'll learn more about these different roles.
And keep in mind, in life, it's the IPE part of the life model. So when you're doing your posters, don't forget about it. Take care. Thank you all. Take care. Have a nice evening.
Y'all did a great job. We were commenting when you're in the breakout rooms that, and I've been on every one of these. This was honestly, and I'm not just pumping up everybody's ego, but this is honestly the most fluid conversation that you all had in those roles, because this is not easy to do. This is not easy at all to take on someone else's role and someone else's professional expertise.
And I went back about 4 years and looked at the past suggestions that were made, and you guys were right on the mark. Thank you. Take care. Bye-bye.
Great job. Great job. I put the link to the evaluation for tonight in the chat, but I'll also send an email like I always do. So please tell us what you thought, suggestions, what was good, what was bad. And we, again, like Dr. Mendez said, we use that and change this every year. So have a great night. We'll see everybody soon, and take care.
Thank you, Margaret.
Thank you.